It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 3 of "My auntie is in intensive care on Ecmo for ARDS. We're very worried she may die. Help." You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our readers, and the question this week is part 4 of "My auntie is in intensive care on Ecmo for ARDS. We're very worried she may die. Help." Part 4. So Lee from the UK writes, "Hi Patrick, I have been to the hospital again today. My auntie's condition deteriorated more overnight. She's now on 65% of oxygen on the ventilator. Her sedation levels have gone higher as well, and they have started another antibiotic. She now has a new infection which has shown on her lung x-rays. The x-ray is also showing no improvement, and they said that turning her on her tummy might be a next step. The Ecmo team has been down to take a look, and at the moment they said she's not at that stage yet where she needs Ecmo again. However, there is a chance that she might be refused because they think if the dialysis machine doesn't work this time, her lungs may have chronic damage. They also said that chronic lung damage may not be reversible, and that's why they will refuse her. Do you know whether there's anything else what they could do for her, or is that the maximum they or anybody else could offer to my auntie? Thank you, Lee." Hi Lee, it sounds like your auntie has gone backwards, and again, this can happen. ARDS and being on Ecmo for only 6 days may not be enough, as once again the lungs may need more time to heal. Turning your auntie might help, and in the old days before Ecmo, patients on ARDS were proned, meaning they were turned face flat onto their tummy with head down in order to drain the lungs and give them a rest. This can be very effective, and I have seen this in the days before Ecmo to be very effective in some patients. It requires lots of sedation though, as it can be very uncomfortable for patients while they're being proned. However, again, this can be very effective. Often, oxygen requirements would come down when patients with ARDS get proned. This can be a lengthy process though, and it often took a few days of consistent proning with 12 to 15 hours proning and then back on a patient's back and so forth. Another option might be high-frequency oscillation ventilation, which is a form of ventilation that protects the lungs by delivering small volumes with a high respiratory rate, which means breaths per minute, in order to deliver oxygen and air. It depends on whether they have such a ventilator in the ICU that your auntie is in or not. However, I would argue, given that your auntie tolerated Ecmo in the first place, that she should go back on Ecmo. However, her oxygen requirements of 65% is probably too early to indicate going back on Ecmo as yet. In order to provide maximum therapy for your auntie means that after they tried proning, and if that doesn't work, they may even consider the high-frequency oscillation ventilator or the Ecmo again. It's not 100% clear to me why your auntie needs dialysis again. Is this because she's in kidney failure, or is this because they want to help her getting rid of excess fluids that are on her lungs? If you could please clarify why she's having the dialysis, that would be good, because sometimes patients have dialysis, and even though their kidneys are working, and they have it because they need to get rid of extra fluids to keep the lungs dry, which is very important in ARDS. Also, I mentioned yesterday, don't buy into the mindset of the intensive care team when they say that your aunt can't go back on the Ecmo when dialysis may not work. It's most likely that if your aunt is going back on Ecmo that she will improve very quickly. Even though Ecmo may not be a cure, it gives your aunt another chance for her lungs to get another rest and hopefully improve. Again, I have seen patients being on Ecmo for up to 3 weeks, so once again, not giving her the option to go back on Ecmo might be a decision you may have to push for it if you think it's the right thing to do. Another option is that if the ARDS can't be cured, that your aunt may be considered for the lung transplant list. Sometimes patients on Ecmo for ARDS or lung failure can be put on the lung transplant list, and Ecmo can be a vehicle to bridge them to a new set of lungs if they become available. Also, keep in mind that now your auntie is only dealing with single organ failure, which is the lungs. Would she be on dialysis for the kidney failure, she would be dealing with multiple organ failure. But given that you've told me that your auntie is on dialysis just to get rid of excess fluids, you're now only dealing with single organ failure. Keeping the lungs dry during ARDS is important to not have any excess fluids on the lungs and aid the healing process. Because your aunt is only dealing with single organ failure, the lungs, it provides a stronger case for going back on Ecmo if need be. Those are all questions you should be putting forward to the intensive care team. Also, if the intensive care team remains negative and they don't want your auntie to go back on Ecmo, you need to dig a lot deeper and you need to consider asking all of the following questions. What are the things that are happening behind the scenes in intensive care that you are unaware of? For example, why are they positioning your aunt's prognosis and diagnosis the way they position it? Are there resource constraints? Does the intensive care team want to treat other patients that they see as more financially viable? Do they want to treat other patients where they can do medical research on? Are they treating other patients because families demand it? If so, you should demand it as well. That's why it's so important that you talk to other families who have a loved one in ICU as well. Also, are they currently experiencing high demand on their precious, scarce and expensive intensive care beds and therefore, quote unquote, pulling out and withdraw a stop treatment might free up a bed that they can use for the next admissions? You should also check out some related articles that I wrote about the topic. 3 things you didn't know are happening behind the scenes whilst your loved one is critically ill in intensive care. Check out those related articles in the written version of this blog below the video. Also, check out this article, How Medical Research Dominates Your Critically Ill Loved One's Diagnosis and Prognosis, as well as the care and treatment your loved one is receiving or not receiving. Click on the link in the written version of this blog on our website. And luckily, everything might be fine. Your auntie might improve without the Ecmo, and if she's not, then you have to be prepared to stand up for your loved one. Intensive care teams can be very shrewd and adept at selling you and your family on a withdrawal of treatment as being, quote unquote, in the best interest for your loved one, if you're unprepared and if you don't know what's happening behind the scenes in intensive care. So let me know how things go and I will keep answering your questions. Take care and stay strong. So, how can you have peace of mind, control, power and influence fast whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or send me an email to support@intensivecarehotline.com with your questions. Also check out our product section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting with me over the phone or via Skype. So check out the products tab, go on the consulting section and book one-on-one consulting with me, and we'll speak on the phone or via Skype. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.